Hello and welcome to the Global Health Insights podcast at the Institute for Health Metrics and Evaluation. I'm Pauline Chu in Media Relations. The discussion topic for this podcast is natural immunity from a past COVID infection. In other words, if you got COVID 6 months ago or even 10 months ago, how protected are you? Well, we have two experts today, Dr. Carolyn Stein and Dr. Hasan Nassereldine from IHME, and they just published a research paper on this very topic in The Lancet. So thank you both of you for being with us.
Thank you, Pauline.
Thank you.
Dr. Stein, let me start with you and set the stage. You both looked at 65 different COVID studies across 19 countries. What were the key takeaways?
Yes. So in our systematic review and meta-analysis, we looked for all published studies as follow-up studies on the protection from a past infection against a subsequent COVID infection. And the main outcomes that you look, these results are for infection, symptomatic disease, and severe disease, which include hospitalization and death. As the main findings that we found, we have that a protection from a pre-Omicron variant against reinfection for a pre-Omicron variant is high, up to 10 months, around 80%. However, this protection from a pre-Omicron variant against an Omicron variant, this reduces or decreases over time to around 36% at 10 months. But at the same time, if you was infected by a pre-Omicron variant, this protection for a pre-Omicron variant or also for Omicron variants provides you a high protection against severe disease. So this is one of our main findings, that the protection against severe disease, against pre-Omicron variants as ancestral, alpha, delta variants, and against Omicron BA1 variant is high at 10 over these 10 months. Yeah.
Okay, so several different scenarios to digest there. Dr. Nassereldine, who exactly did you look at in these studies? For example, were they vaccinated people or unvaccinated? Had they been infected once or never infected? Can you give us a breakdown of the groups?
So most of the papers, they analyzed patients that were or never infected and never vaccinated, or never infected and vaccinated, but they adjusted for the vaccination status, versus people that had one infection and were never vaccinated. And they looked at the rate at which each category or each group had a second infection. So it's like a group that were never infected, vaccinated, or non-vaccinated, depending on the vaccine status. The vaccine status were adjusted for, and the group that had one infection, and they compared the rates of the second infection in each group.
And one of the key takeaways that you came away with was natural immunity wanes over time. In other words, time duration matters. It really changes depending on the situation. So tell us a little bit more about that.
So when we were looking at how immunity wanes over time, so for the group that had an infection with a pre-Omicron variant, and for studies that also looked at a second infection in pre-Omicron variant, immunity did not wane significantly. So over a 10-month period, the protection remained over like 75% or 80%. However, when it came down to Omicron variant or the current dominant circulating variants, a pre-Omicron infection had a significantly reduced protection against the current Omicron variant. So it was like 36% over a 10-month period. So immunity waned significantly more for Omicron versus the pre-Omicron variants.
Dr. Stein, as people read this research, they might come away with the idea that I got COVID, I have natural immunity, so I don't need to get a vaccine or a booster. What would you say to that?
Yeah, this is not the case that we found that yes, the pest infection provides you a protection, but we should keep in mind all the and weighted the risks related to this for risk related to the comorbidities and death. But one point is that we should recognize both natural immunity and vaccination status in consideration to obtain a full picture of an individual's immunity profile. Vaccines continue to be super important to all of us, and mainly to protect in high risk populations, as though those that are 60 years of age, over 60 years age, and with comorbidities. Also, for those that were never infected, the vaccine still is the safest way to acquire immunity. And also who were infected or received their vaccine dose more than 6 months ago. The vaccination is the safest way to acquire immunity against COVID.
So is there some sort of magic window in terms of time interval? For example, if you've gotten COVID and it's been 6 months, this is now the time to get a booster?
Yeah, correct. It could be when more than 6 months, and our findings, because the protection from a pest infection or the protection from a vaccine wanes over time. So our results, our findings support the need of annual vaccinations.
Dr. Nassereldine, in this research, you looked at 65 studies across 19 countries, and it covered pre-Omicron variants like ancestral, alpha, beta, delta, up through Omicron variants of B4 and B5. Right now, we're dealing with XBB, so that's what the focus is on. And I realize the study didn't cover XBB, but what does all of this research mean for today and for the future in general?
So, as we have seen with the COVID virus, it has been the new variants have been emerging over the last 3 years. So, from our study, we've seen that protection from pre-Omicron variants against the pre-Omicron variant, although this is only for historical purposes, it was a high level of protection. The current dominating circulating variants, like for BA1, BA2, BA4, BA5, and so on, pre-Omicron variant had a much lower protection against those variants. And if a person had an infection with an Omicron variant, and we wanted to look at the level of protection against a second Omicron variant infection, the level of protection was okay, like around 75% for most studies. Current dominating circulating variant, we would like to think about it in the same way. Like if you currently have if you had a pre-Omicron infection, if you're thinking about getting what is the level of protection currently against an infection, it's going to be low. However, for severe disease, it's going to be high. Also, if you got an infection with an Omicron variant and you're looking at a second Omicron variant infection, probably for severe disease, it's going to be high. For against infection, it's going to be kind of mid or to like 75% or so.
And Dr. Stein, let's talk about vaccines. The research showed that a past COVID infection up to a certain point can provide the same amount of protection in terms of immunity of at least a 2-dose mRNA vaccine, particularly Moderna and Pfizer. Flesh that out for us and how effective these vaccines are, and what other vaccines did you study?
Yes. As you say, and the level and duration of the protection provided by the two doses of vaccines is at least equivalent. And these vaccines, so we have the Pfizer and Moderna, this comparison, also AstraZeneca. And we have, so these at least equivalent results of protection for against infection, symptomatic, and severe disease. And again, for all the variants, including Omicron B1. We should consider that these results for vaccines are only for monovalent vaccines. So in these comparisons, the new bivalent vaccines were not included, and yeah, it's the safest way to acquire immunity by vaccination.
Dr. Nassereldine, finally, what do you want people to walk away with after learning about your research?
So I think the most important points for us from the study would be, like, we should recognize natural immunity as a very good source of protection, which is at least good as a 2-dose mRNA vaccine dose. And also we should also, despite having a good protection from infection, we should also keep vaccines as the safest way to get immunized, especially for elderly people and people with comorbidities, and also people that work in high-risk environments. So although we believe natural immunity is strong, we should still keep vaccination as our most important way to get immunity from COVID.
Such important takeaways. Thank you so much, Dr. Hasan Nassereldine and Dr. Carolyn Stein, for joining us on this podcast.